everyone, my name is Zenjan. Welcome to my den. Today I'd like to share with you a little self-care, a self-massage to help boost the immune system, reset our nervous system response so that we can be less stressed and more relaxed, as well as relieve any excess phlegm or mucus that we might be experiencing in our lungs. Now, just a little disclaimer, this is designed for a healthy person, somebody who is functioning normally, that doesn't necessarily have any illnesses or isn't currently sick or experiencing respiratory distress. If you are experiencing illness, disease, respiratory distress, things of that nature, please contact your physician, or if it's an emergency, of course, 911, and do not use this treatment. This treatment is just for a normal self-care routine, just to help improve your overall health and well-being. So with that being said, this is something that you can do for yourself on a regular basis. If you have a partner or a friend, a roommate that you trust, or kids, this can be a lot of fun to do for each other if that's available, or you can even just do it to yourself. I'm going to do it to myself today, but know that you can participate and do this with a partner as well. The first thing that we can do is a respiratory percussion. In massage, we call it tapotement. It's a light, gentle tapping. We're going to use a soft fist. So with a soft fist, the fingers are just loosely closed. We're not making a tight fist. We're not punching anyone here. So just a gentle, soft fist, very loose wrist. And just to get the feel, you can begin kind of tapping on your hand, very soft. And what we're going to do is we're going to work around the area of the lungs. So if you can imagine where the lungs are in the body, it's generally around the rib cage. Now, if you have a partner that you're working with, you can lie down on a surface on your belly and have your partner tap your back, so you can get the back area of the lungs, because that's not really an area that we can reach on our own. And that'll be really beneficial. And as you're lying down on your belly, you're able to release any phlegm or mucus, discharging that from your system, coughing it up and out, and getting rid of that a lot easier. But today I'm going to show you how to do it to yourself the best that you can. If you have a partner, it's great to do on your back, which we won't really be able to reach that much on our own. Now, before I begin, what I like to do is I like to use an essential oil to help loosen up that phlegm, that mucus that might be stuck deep down in the lungs, as well as the actual respiratory percussion. So some good essential oils for respiration are doTERRA's Breathe oil. It's a nice blend. Peppermint oil, eucalyptus oil, rosemary oil, and cardamom oil. So any of these oils are very good at relieving any stuck congestion we might be experiencing. And I use doTERRA's essential oils because they are proven effective, they time-tested results, and they have the purest quality of oils. for instance, the difference between an essential oil and an herb is an essential oil is a lot more potent. So peppermint oil, 1 drop of peppermint oil equals 28 cups of peppermint tea. So imagine how good you feel after breathing in a nice hot cup of peppermint tea, and then comparing that to 1 drop of peppermint oil. So you can use any of these oils, taking a drop in your hand. We're going to make it our own little diffuser by rubbing the oil into the palms of the hands, creating a cup, and then placing it over the nose and mouth, being mindful of the eyes, so avoid the eyes, and then taking a few deep breaths in. And try to take deep breaths in from the belly, filling up the lungs. And breathing in and out here. And you might already begin feeling a little bit of the breaking up of the congestion deep down into the lungs. And maybe you might already start feeling a little bit more relaxed here with the deep breathing as well. Now, so we'll begin the respiratory percussion, taking our soft fist, and then just tapping around the area of the lungs, being mindful, making sure we're gentle. And we can take this fast or slow. Notice our own rhythm. Trying to get deep down into the lung areas. And then the chest. You might already be experiencing a little bit of mucus or phlegm. And just to give you an example, I am 100% healthy right now. But I am a Michigander, prone to sinus problems. So just trying to get into every area of the lungs that we can reach. And I'm already feeling the congestion breaking up. If you need to cough or spit it out, blow your nose. Anything that you need to do to get this up and out of your body. Keeping those airways loose. And you can do this for as long as you need to. So I'm going to stop because I could continue going, but just for demonstrations purposes. So getting that up and out, clearing out our airways. So then, so there's that technique, and then I also want to show you another great technique that you can start doing in your daily practice, is opening up the lymphatic system, and which will help improve our immune system. And this is just a simple technique that we can do for ourselves on a daily basis. The immune system I mean, the lymphatic system doesn't really have a pump of its own, so it really can use our help in help opening up the duct and allow drainage to circulate and flow a little bit more freely. So how we can do that is just above the collarbone at the base of the neck. Very soft touch. The lymphatic system lies just underneath the skin, so it's superficial. So you just need a soft, gentle touch. So this act can be very soothing, very restorative, very relaxing. Just this simple act. So we're going to begin at the base of the neck, and I'd like to just say this rhythm to myself. So you want to press on the skin but downward. So just pressing on and down and say on, 1, 2, 3, and then release, off, 1, 2, 3, on, 1, 2, 3, off, 1, 2, 3. Pressing on and down, and then off, 1, 2, 3, on, 1, 2, 3, on, 1, 2, 3, off, 1, 2, 3, on, 1, 2, off, 1, 2, 3, on, 1, 2, 3, off, 1, 2, 3, on, 1, 2, 3, and then slowly moving up the base of the neck around the collarbone. On, 1, 2, 3, off, 1, 2, 3, 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 and continue gradually moving up. On, 1, 2, 3, off, 1, 2, 3, 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 on, 1, 2, 3, off, 1, 2, 3. And then I like to move now to the base of the neck and use the tops of the fingers here and do the same where you're kind of pushing downward. On, 1, 2, 3, off, 1, 2, 3, on, 1, 2, 3, off, 1, 2, 3. Very gentle. On, 1, 2, 3, off, 1, 2, 3, on, 1, 2, 3, off, 1, 2, 3. And then slowly moving up the neck. On, 1, 2, 3, off, 1, 2, 3, 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 on, 1, 2, 3, off, 1, 2, 3. Slowly moving upwards. On, 1, 2, 3, off, 1, 2, 3. 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 Okay, now we're just going to take the hands open and just kind of sweep the neck down back to where we began at the base of the neck. Do that a few times, sweeping the neck down gently. And then I like to take the 2 peace fingers and apply them at the base, at behind the ears, and just gently rub here. This helps stimulate the parasympathetic nervous system, our rest and digest function, restoring our nervous system, allowing the body to relax. reducing our cortisol levels, which is the stress hormone. And then you can take deep belly breaths here. Maybe go down the neck. Be gentle. And just kind of notice how you feel. Okay, now we're going to continue this with the arms. So allowing the right arm to come up. We want to start proximal to distal. So proximal is approximate to the duct. So it's the closest area to the duct, and then we're going to work our way up to the most distant point. So starting here, just so we can use a full open hand and just kind of begin to do that same downward motion on 1, 2, 3, off 1, 2, 3, 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 and then just moving around the arm on 1, 2, 3, off 1, 2, 3, on 1, 2, 3, off 1, 2, 3, off 1, 2, 3, on 1, 2, 3. And make sure that you're very light with your pressure, very gentle, moving around the base of the arm. On 1, 2, 3, off 1, 2, 3. 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 And if this is too much for you to be able to support your arm like this, you can rest your arm at somewhat of an elevated surface. So the idea is to always bring the limbs above the heart. That's a pretty good check-in point. So if you can rest your arm on something that is above, maybe if, let's see, if you have a pillow here, see how my arm is a little bit more elevated, and then I can do that. If it's hard for you to support your arm up like this. So we're just going to move down, we're moving up the arm, but the stroke is slightly pulling down. Very gentle, a gentle pull. So on 1, 2, 3, off 1, 2, 3. 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 So working all the way up the arm towards the hand, and then just sweeping it down back to the duct where we started. And then we'll continue with the left arm so that we're nice and even. So again, starting at the base of the arm. And you can find that rhythm again, where it's on 1, 2, 3, off 1, 2, 3. 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 On 1, 2, 3, off 1, 2, 2, 3, off, 1, 2, 3, on, 1, 2, 3, off, 1, 2, 3, on, 1, 2, 3, off, 1, 2, 3. And I'm moving a little bit faster here. But please, when you do this for yourself, take your time. And again, if it hurts or is uncomfortable or awkward for you to elevate your arm like this, please elevate it with the support of pillows or anything that could help keep the arm a little bit higher than the heart. And then again, we're going to sweep the arm down. Coming back to that duct, that base of the neck where we started. And then just notice how you feel here. Now, to help the lymphatic system of the legs, very simple. If you can just recline with the legs elevated on a daily basis, that will help. Again, we want to make sure that it's always above the heart. So if you're able to come down onto the floor, bring legs up a wall for support, or I have my couch here that I can lay back and elevate my legs on. I can even use a pillow for a little extra support. And I can recline back here for, typically you want to recline for 5 to 15 minutes, whatever's comfortable for you, where you can have the legs supported. If you're comfortable with just legs in the air, doing a candlestick pose like that, then that's great too, or make sure that you're supported. If it's not possible for you to get down onto the floor, if you have a recliner, you can lay back in the recliner and then put pillows up on the foot part to help elevate the legs. If you're in a bed, the same thing. You can add extra pillows underneath the legs and the knees to help elevate the legs. Or if you're on a couch, maybe you can lay back and put your legs up the arm of the couch and maybe add some extra pillows there for extra support. So there's many different things that you can do to elevate your legs. It's very important that we elevate our legs every day. We're on our feet a lot, so it helps to reverse that, as well as reset our lymphatic system. And it's nice to just be able to take some pressure off and just be able to relax for a little bit. So take this time out. Make sure that you take some time just for you. And and I hope to be able to provide more of this kind of service, this self-care support. So once again, my name is Zenjan, and thanks for checking in. This is my den. Take care of yourself always. Thank you.